Good morning. Can I speak with Homer Simpson, please?
I'm Homer Simpson. Who's this?
Hi, Homer. My name is Louise Russell, and I'm one of the nurses at the Springfield Medical Centre.
What do you want?
Homer, I wanted to speak with you about your recent diagnosis of type 2 diabetes.
Go!
So, Homer, I just want to run through some details with you. It says here that you are 46 years old, non-smoker, and you work as a safety inspector at the nuclear power plant.
I work 12 hours a week,
You live with your wife and 3 kids. You drink around 4 beers in the evening. And with regards to exercise, you occasionally walk home from Moe's Tavern.
That's right.
Your father has type 2 diabetes and coronary artery disease.
Yeah.
Your current weight is 315 pounds and your BMI is 42.7, which would put you in the morbidly obese range.
I'm a big fat pig.
Homer, there are many lifestyle changes you can make to bring those numbers down, and we can certainly help you with that.
Thank you.
So the doctor has prescribed 500 milligrams of Metformin twice daily.
Yeah, probably.
So I wanted to talk through type 2 diabetes with you. Is now a good time?
Yes, sir.
So when we consume a meal, glucose enters the bloodstream, which stimulates the beta cells of the pancreas to produce insulin. Insulin is a hormone released into the bloodstream which facilitates the removal of glucose from the blood and into our cells for energy and storage. Our muscle and fat cells contain insulin receptors, and once the insulin binds to the receptor, this initiates GLUT4 channels to open and allows glucose to enter the cells. Insulin stimulates glycogenesis in the liver, which essentially converts glucose to glycogen for storage. Once liver glycogen stores are full, insulin stimulates glucose to be stored as fat in the adipose tissue. Unfortunately, in type 2 diabetes, there is insulin resistance. What that means is the insulin receptors are less effective, which prevents the glucose from entering the cells and results in a high concentration of glucose in the blood. Initially, the beta cells in the pancreas secrete more insulin in an attempt to reduce the blood glucose levels. But unfortunately, as the disease progresses, the beta cells cannot cope with these demands and these cells are destroyed. When this happens, insulin therapy will be required. When the cells are starved of glucose, the alpha cells in the pancreas secrete glucagon, which stimulates the liver to release glucose back into the bloodstream in an attempt to get this into the cells. This is referred to as glycogenolysis. Abdominal obesity is the single most important risk factor of type 2 diabetes. So Homer, we're talking about the visceral fat you have around your tummy.
What's the big deal?
Well, the visceral fat releases fatty acids, hormones, and pro-inflammatory cytokines, which leads to low-grade chronic inflammation, which blocks the insulin receptors and prevents cells from receiving glucose. As the visceral fat increases, the release of pro-inflammatory cytokines does too, which can lead to insulin resistance. So let's talk about your medication.
Oh, sure.
Metformin is an anti-hyperglycemic agent, otherwise known as an insulin sensitizer. Metformin increases AMPK, which lowers hyperglycemia without stimulating insulin secretion. It reduces hepatic glucose production, lowers inflammation and cholesterol, and reactivates the GLUT4 channels, which allows glucose to enter the cells, which ultimately results in lower blood glucose levels.
Woohoo!
So Homer, we'll also need to check your Hba1c levels regularly. Hba1c refers to the glycated hemoglobin. Hemoglobin is the protein in red blood cells that transports oxygen throughout our bodies. As red blood cells have a lifespan of around 120 days, this test provides us with an indication of how much glucose you've had in your blood over the last few months. This will help us determine whether your condition is well controlled and if we need to make any adjustments to your medication. This is really important as over time, poorly managed type 2 diabetes will result in microvascular and macrovascular complications. High blood glucose levels attract water into the blood vessels, which causes endothelial swelling. This damages the cells and causes proliferation, resulting in thickening of the walls. This reduces the delivery of nutrients to the nerve cells, which causes demyelination of Schwann cells that surround and insulate nerves and leads to poor nerve conduction. This results in profound pain and temperature impairment. High blood glucose levels also contributes to the formation of fatty acid deposits in blood vessels, which damages the arteries and can restrict blood flow to the heart and brain, leading to a heart attack or stroke. I'm sure that's a lot to take in, Homer, and I guess what I'd really like you to take away from this call is that there is a lot that you can do to slow down the progression of this disease.
Don't you give up on me.
Homer will always be here to support you, and if you have any questions, please don't hesitate to contact us.
Thank you.
Homer, I'll send out a copy of everything we've talked about in the post for you today.
Yeah, I'll be sure to take a look at that.
Okay, Homer, well, it was really good to talk to you, and we'll chat again soon. Bye!
Nah.